Okay, I'm really sorry. There were some net issues. So we were discussing about the lingual plate. Okay, so lingual plate, as I told you, it is same like a lingual bar, but it will be extending to the superior border on cingulum of the anterior teeth. Okay, so and it should be supported by the rest on both the sides. Okay, so now what are the structural requirement? It should follow the natural contour of the tooth and it should contour to intimately contact the lingual surface of the teeth. Okay, so if you see here, it should actually intimately, like there should be a nice contact with the lingual surface of the teeth and it should be scallop like the interproximal surface of the teeth like this. Okay. So this is about the superior border. Now the inferior border is again half pear shaped like the lingual bar and it is positioned low in the floor of the mouth as much as possible. So now here this point is important that here we don't need a 8 millimeter of distance. Okay, because in that case the bar was a thin bar which has to be specifically made at least 4 millimeter wide. But for the lingual plate we don't have such recommendation because already the plate is extending above till the cingulum of the teeth. So we don't want, at least if the 8 millimeter distance is not there, also we can indicate a lingual plate. Okay. So if you see the lingual plate, indications are high lingual frenum, space from the gingival margin is less than 8 millimeter. Now, if you see this is extending too much onto the teeth, right? So that means the amount of support it is taking is more. So if the ridges are resorbed, okay, if the teeth is periodontally compromised, it also acts as a splint. If you see here, it is covering the teeth. So it's covering all of the teeth. So if the teeth is even moving, it is covering and acting as a splint to prevent the mobility of the teeth. So in that case also we indicate a lingual plate. Okay, and of course, if the teeth are too much lingually inclined, most of the lingual major connectors, if the teeth are too lingually inclined, it is very difficult for us for the insertion and removal of the RPD. So that's why all the lingual major connectors are indicated, and then we go for the labial mandibular major connector, labial bar. Okay. What can be the advantage? Yeah, see the amount of coverage, it is also taking the support from the cingulum of the teeth. So that's why it is more rigid. It is more comfortable to the patient because if you see it's a smooth lingual plate, it is not like there is a junction of teeth and then there is a bar. Okay. And it also acts as a splint for a periodontally compromised patient. Now, what is the disadvantages? Extensive coverage, because if you see there is too much of coverage, it might cause enamel decalcification. Okay, so there is a decalcification of the enamel surface. Also, it may cause soft tissue irritation. Okay, so because of the coverage, obviously. Okay, and if the spaces, if there is some space between the teeth or something like that, there can be chances of food trapment. So these are some of the disadvantages. Now there is one more modification of lingual plate. Like if you see there was a modification of lingual bar to a sublingual bar. The modification of lingual plate, suppose there are open embrasures or there is a spacing between the teeth. If you see here, there's a open embrasures and there's a spacing between the teeth. And if we give a plate like this, which is covering till the cingulum of the teeth, the cingulum, the metallic part can be visible. There will be a display of the metallic part when the patient smiles. Okay, so we obviously don't want that. So what we do is we do something called as step backs. Means we modify the design so that we lower this in this interproximal area, the embrasure, the open space area. So we lower the margin like this and we give a design like this so that the metal is not visible in the patient's mouth. Okay, so this is called as step back, which is a modification of lingual plate in case of open embrasures. Okay, so we have already discussed the three types. Now the fourth one. Okay, the fourth one is called as double lingual bar, which is also called as a Kennedy bar. Okay, so the name is double lingual, means obviously there are two bars. Okay, now where are the two bars situated? The one bar is situated in the cingulum, so it's called as cingulum bar, and the second one is the lingual bar which we give. Okay, so if you just remember the design of a plate, the plate was completely extending till here. In this design, what we have done, the center part of the plate is being removed. So we have two borders. So we have the superior margin and we have the interior margin, inferior margin, but the middle part has been removed. Okay, so this is called as double lingual bar or a Kennedy bar. Okay, so as in lingual plate, the upper and the lower compartments of the double lingual bar are not joined by a continuous sheet of metal. Okay, if you see, this is not joined by continuous sheet of metal. Here it is a lingual plate. This is all metal. Now here, this part is removed, and this is a gap here. Okay, so as a result, what happens, the lingual surface of the teeth and this are largely exposed, not all of them is covered, so this part is not covered here. So if I talk about the design, it is just the same. It is half oval, in cross section, and this is half pear shape. This is the inferior border, and this is like this is the inferior bar, and this is the superior bar. The superior bar, the upper component will be scalloped according to the teeth margins. This cingulum area. Okay, and the two bar joints again are like, here also the thing is, it should be supported by a rest. Can you see here, the rest should be placed at each end of the upper bar. This is the upper bar, so there should be rest on each end of the upper bar, which should be preferably in the mesial fossa of the first premolar. Okay, so when is it indicated? Indicated when contact with the remaining mandibular anterior teeth is needed. Okay, so in that case you can indicate, and if you see here, there are two bars, two rests which are located. Okay, so the next one, the advantages. What can be the advantage? The advantage is, since it has two, if you see here, it has two rest seat like a plate, so it gives extra indirect retention. It contributes to stabilization, and only thing is, advantage is this part is open. If we compare, most of the thing is same like a lingual uh, plate, but this part is open. So the other advantage is gingival and interproximal areas are not covered. Okay, so this may be an advantage or this may be a disadvantage. Now what, the same thing can be a disadvantage because it will cause more food entrapment, because this part is open, so there are chances of more food entrapment, more debris, and also this kind of design is more causing more irritation to the patient's tongue. If you see here, if there is a plate, okay, there is a smooth transition, but if there is a two bar like this part is more discomfort to the patient. Okay, so now the fifth one is called as a cingulum bar, okay, which we have already seen. This is just a cingulum bar. In double lingual bar we had two bars. Here we will have just one bar, which is a cingulum bar, also called as continuous bar. Okay, since it is a thin bar which is only located on the teeth, not deriving any support from the bone or the mucosa, this does not give good rigidity. Okay, so this is the disadvantage. But yeah, in case of too many lingually tilted teeth, maybe we can, think about it, because it will only be here. It will not go too much down for difficulty in inserting and removing the prosthesis. The last one is the labial bar. Okay, so the labial bar is, the name suggests, labial bar means it is placed in the labial side. If you see here, the bar is located in the labial side. So if you see the design, it is very clear that this would not be very comfortable to the patient, right? It would not be, the patient cooperation will not be there. Definitely it's not comfortable to the patient. But when there is severe lingual inclination of the teeth, or if there is a too inoperable tori which the patient is not ready for removal, the teeth are too much lingually inclined that you cannot get a good path of insertion and removal for your prosthesis, in that case you give a lingual bar. So you have a bar which is running on the lingual surface of the teeth. Now what can be the disadvantage of this? See, because it is a bar, definitely the thickness will be more. So now if you increase the thickness of the bar, what happens? It causes more fullness or bulky part on the lower lip. If you see the front part of your lip, it will cause more bulky lip and cheek in the front. Okay. Also, you need good amount of labial vestibular depth. If there is a good depth, then only you can give this. Okay, so only advantage is when the patient is not ready for the removal of tori, and when or it is not because of the patient's health condition, or the teeth are too lingually inclined. But it is poor patient acceptance. Patient will not accept it easier. It is more bulkier. It causes more discomfort to the patient. Now there is one more design which is called as modified swing lock, okay, which is a modification of your labial bar, okay. If you see here, swing lock means it's like a lock, okay. So you have a labial or buccal bar which is connecting here. If you see here, this is a bar, and there here we have a latch. So it's like open key and close, okay. So you open the latch. You have seen a door or a gate, like you open the door and then you close the door. So it's like a latch here. See here, can you see here? You can open it like this and then you remove all the processes. So here you have, you you want more support, right? So you have multiple rest on remaining teeth here. So if you see all this, we have multiple rest, okay, and we have stabilization from the lingual plate also. We have a lingual plate also and a bar also. Okay, even though the teeth is inclined, when we have a lingual plate and a bar, because it is hinge like motion, so you can open it and you can remove the processes. So the problem which was there for inserting and removing the processes with lingually inclined teeth is solved, because it's like a hinge. So you don't need to, just open it, and you can change the path and remove the processes. Okay, so now again, this is not very commonly indicated for common general patient, because maintaining hygiene is very difficult. If the shallow vestibule is there also, it is not indicated. Okay, when it is indicated, when some of the teeth have questionable prognosis, or as I told you, in case of lingual inclination of the teeth, you can indicate this. Okay, so what I discussed about swing log design, you can just go through it. No need to read for exam point of view for a third year undergraduate student. But you should just know it, like just read the slides. But yeah, you will not need to learn everything about the swing log design. But rest of all the designs, you need to learn them all for your exam. Okay. Now, and I'm sure as you practice this in your sessions, it will be more clear. And in the clinics, in the lab, when you come, if you want, we can show you some models to discuss about it again. Okay, now just if I show you this picture, the what we are showing here is the distance. This should be 4 and this should be 4 for giving a lingual bar. Now what is this? This is a lingual plate with a interrupted lingual plate or setback design, because there is a spacing between teeth. If you see, there is no spacing in this teeth, so we have not done here, but there is spacing in this teeth, so this is being done here to avoid display of the metal. This is a continuous bar or a cingulum bar, which is not very rigid and not indicated commonly. This is a double lingual bar, also called as a Kennedy bar. What is this? This was for your revision if the lecture was on site, but I will just revise again like this. And this is a lingual bar. Okay, basically I think this is a sublingual bar if you see from this picture. Okay. Then again, this is a double lingual bar. This is a lingual plate, and this is also a lingual plate. Okay, so these are some of the designs for an example. Okay, now some of the, just a quick revision on which major connector is indicated in which situation. If we talk about a tooth supported removable partial denture, more commonly we give a lingual bar provided the distance is 8 millimeter from the pre-gingival margin to the floor of the mouth. If the distance is less than 8 millimeter, we would prefer giving a lingual plate. Okay. Now, when there is the teeth have reduced periodontal support, we give a lingual plate, which also helps in stabilization of the teeth. Okay. When there is bone loss, and when also we give a lingual plate. Okay. The next one is when there is open interproximal area or space between the teeth, we give a lingual plate which is modified like a step back design. Or we can give a double lingual bar in this case, because we have two lingual bar, so it will not be displayed, the metal will not be displayed. Okay. Okay, and when you have to replace more number of missing teeth in distal extension cases, like all the mandibular posterior teeth are missing, we would prefer giving a lingual plate, because it provides more support, and also it is always supported by two rest seat on preferably the mesoocclusal surface of the first premolar. And the labial bar, they have some indications in case of severely lingually inclined teeth or a tori, but it is rarely indicated because it is very uncomfortable to the patients. Okay, so these was a quick review about the mandibular major connector. So you can get back to me about any doubt or anything, and we can obviously discuss what if there are any doubts in the clinical session. Okay, thank you so much. Good day.